Doctor here, if you're on a zepbound or tirzepatide and you wondered what would happen to you if you stopped taking these medications, there was actually a study that answered that question called the Surmount 4 trial. And this trial looked at patients who were on tirzepatide, maximal dose tirzepatide, for about 36 weeks. And these patients on average lost 21% of their body weight. But then for the remaining year, they were given a placebo, or they basically stopped this medication for about a year. And the results of this study was actually pretty interesting. We saw that 70% of these patients that were off these medications for 1 year, 70% of those patients regained less than 25% of the weight they had lost. So for all intents and purposes, they essentially did not regain most of the weight, if at all, back. And about 80% of those patients, unfortunately, they regained more than 25% of the weight they had originally lost. And then 50% of these patients, they regained 50% of the weight they had originally lost. And then lastly, about 1/4 of these patients regained most of the weight they had lost. I think it's important to understand that these patients that were on placebo, in their mind, they thought they were still on tirzepatide. They were still following a calorie restricted diet. They were still working out. They were still seeing a nutritionist, dietitian, still trying to lose weight. And for the majority of them, 80% of them still regained 25% of the original weight they had lost, despite doing everything they could to try to lose weight. I think this highlights the importance of seeing obesity as a chronic illness, because we do know that these GLP medications have cardiovascular benefit beyond just weight loss. They improve cardiovascular risk factors such as a heart attack or stroke. So I think it's important to understand that they have benefits beyond weight loss. But looking at weight loss alone, they improve hunger signaling, they improve a brain fog. So for a lot of patients, they might regain some weight. There's a lot of variance when it comes to the weight they might regain while off these medications. 70% of these patients were able to keep off the weight, but I think that highlights that every person is different. Every person should be treated differently. Just like someone who comes in with severe hypertension, you don't tell them to just go off the medications and have a good day, because that could be catastrophic. They could come in with a brain bleed. I think similarly, we need to start treating obesity as a chronic illness and expect patients to potentially come off GLP medications, but it shouldn't be done so drastically like this study did. I think in the future, we're going to start seeing microdosing as an acceptable way to potentially be able to titrate patients off these medications. But I think this research highlights the importance of seeing obesity as a chronic illness and not necessarily pointing fingers at someone who can't lose weight because of a lack of willpower, when in general there's a lot of different variables. But truly trying to understand the physiology of the person, because at the end of the day, even though calories in versus calories out does equal weight loss, if you're in a calorie deficit, the way that someone reaches that is going to be different. Every person is going to have a harder time reaching calorie deficit because of their metabolic demands